Sinucare is a minimally invasive, affordable ENT device that allows doctors to dilate the sinus openings and facilitate better ventilation. The patient is placed in the supine position with their head elevated and anesthetized. The patient will then undergo a routine nasal endoscopy procedure with Sinuguide mounted onto the scope. This allows a single hand to insert both the scope and the device, leaving the other hand free. The endoscope is then aligned to facilitate access to the blocked sinus ostia. The free hand can use instruments to help maneuver the scope. Through Sinuguide, the balloon system sinuvent will be passed into the sinus. The soft distal balloon will be inflated using air in a standard syringe with the free hand. If the inflated distal balloon is not visualized, it means that sinuvent has been successfully introduced into the sinus. Sinuvent is tugged gently to anchor the distal balloon against the inner wall of the sinus and position the proximal balloon inside the narrowed opening. The proximal balloon is then inflated with the free hand to 12 atmospheres using the pressurized inflation system provided. The inflated balloons are held in position for 10 to 30 seconds before deflating. The deflated balloons are retracted into Sinuguide and removed with the scope. The process is repeated for any other inflamed sinus using the appropriate Sinuguide and endoscope combination. Secretions can be drained and medication administered to the unblocked sinuses.